I've been a nurse for 15 years. I was doing the math. I was like, oh my gosh. I started in North Carolina and I started working on what's called a task division, trauma and surgical services. And I did that for, I think, all of 3 years. And I did a bunch of different things, floated all around the hospital and absolutely loved it. I mean, trauma was really like a huge love of mine and working with bariatric patients and all of those things. Um, and then so then I ended up like jumping into a sales role from there, and I think that that's kind of like where the business side of things kind of like lit up that side of my brain.
So, and correct me if I'm wrong, did you transition to an oncology role? And then was your sales rep job in oncology? So, do you think that having that bedside experience helped with that?
Totally, yeah. So I actually got hired for an oncology floor, One South at it was Vidant Medical Center back in the day. It's Pitt County now, ECU Health in North Carolina. Awesome hospital. Huge shout out to them because they really made me into the nurse that I am today. Um, Lots of opportunity there. And so one thing that I've made a bunch of notes here, and I know this is a podcast for everybody, and so
Yeah.
I'll just give some old guy advice right from the get-go. I mean, truly, having like a common denominator right off the bat. Mine's always been oncology, and from there, like I said, I've had different types of offshoots, but really just trying to be like focused on one thing, be it cardiovascular, neurosciences, neurosurgery, whatever it is, traumatic brain injury, whatever your passion is. Always try to keep that in mind if you're ever thinking about transitioning maybe into a business role or something that might be a little bit more non-traditional. So I worked as an oncology nurse, and then I did a little bit of home infusion. And so I worked for a company that was called Advanced Home Care for, I think another, 3 years. And that seems to be my number. I think I'm looking at it. And and so I did that. I was, I met a guy through just networking at the hospital as much as you can. I used to see a rep come through. I'm like, you're a nurse? I'm like, what do you do here? Right? Because that's like a very common question that I ask people. And he came in, Eric, and he's like, well, I'm going to be leaving this role. He's like, I come in and I educate patients, and so what we would do is send them home they'd go home with PICC lines, usually like a double lumen PICC line, and I would teach them how to use the PICC line and how to troubleshoot it. And I was the liaison with the offsite pharmacy for TPN, for those of you who know, it's all these infusible drugs, even chemotherapies, but mostly antibiotics and sometimes some analgesics as well. Anyway, so there's this whole cascade of different types of accounts that we would have it was a trauma one center, and it was like 1,000-bed hospital. So that was my territory. And so that was my first foray into sales. And thankfully I did well. And it was one of these things where I was like, this is really cool. I mean, I get to talk all day, right? And then just like educate patients. I was like, this is perfect for somebody like me. So I left that job. We ended up coming back up north. We had landed in a town called Cornish, and we knew that we were going to be in southern Maine, and my mom lives up there as well. And so there was like this huge family dynamic trying to get back up north. And I ended up working for a boutique hospital just for a short stint. It was like a 6-to-1 ratio. And for me, it really wasn't, I had gone from working in North Carolina with a hugely different demographic. Came back up north, and I was like, it wasn't like totally my vibe. So I ended up like, long story short, working with a surgeon. I have a buddy who's a surgeon that I worked with in North Carolina. We were like, hey, he's in Maine. And so anyway, we invited him over to dinner, ended up getting the job as a surgical oncology nurse navigator for Maine Health, which is the flagship hospital for a large system throughout Maine and in New Hampshire as well. But anyway, so I did that for, again, 3 years, I think. And then, my work mom, Gina Blazek, she'll probably watch this. She was like, Mandy, she's like, you've got to go to some of these rep dinners. She was like, you're like them. I was like, I don't even know what that means, And so I was like, okay. I was like, oh, after lots of like conversation about it, I ended up attending a few of them. And so again, back to the networking piece, like,
Yeah.
I quickly realized, I was like, okay, so if I can go through, and I worked in immuno-oncology at Bristol Myers, and so awesome franchise, and just they do so much great work for patients. And so I was like really blessed to get this job. I ended up like meeting some of the reps, and they're like, Manny, this is a great job. There's so much that we could talk about with the pharmaceutical rep role. And again, if anybody ever has questions, they can just like, I guess just contact me as a one-off because it's a lot. It's a lot. And I know
Yeah.
one of the questions that you had was regarding, what it looks like to be a pharmaceutical rep.
Yeah.
So started off working in psychiatry at Boston Medical Center, which
Yeah,
I
I
mean, they've
saw
all changed
that.
names. Yeah. But
Yeah.
so yeah, no, so I think, working as a pharmaceutical rep, it's just like there's just so much education, and it's like, you ask what it looks like. So, as a
Yeah.
nurse, you're standing for like 13 hours, right? The
Hmm.
brochure tells you 12 hours. The reality is like you're actually like you don't get lunch, right?
Yeah. Yeah.
And your handoff never takes 5 minutes when you're, coming off of a shift. So the reality is like as a pharma rep, like really you're out there and you're hitting your accounts, and you have a designated territory, and I can't tell you exactly what mine was, but suffice to
Hmm.
say that it was pretty large.
Yeah.
And it was great because I was able to get out there and talk to nurses and just like all types of different physicians and all the stakeholders that work with the patient.
So
And
cool.
yeah, no, it was awesome. And for me, it was like a great segue into the business world because I understand the multidisciplinary team. So
Yeah.
if I had to say like nurses, like never doubt the fact that like the knowledge that you have about the patient journey. One of the things that I wrote down is like,
Hmm.
why would someone like me be, sought out? The reality is having that knowledge of the patient journey, understanding what they go through. I mean, truly,
Hmm.
like those are things that are really like large companies want to know about that stuff. And I mean, I
Yeah.
think you could be a consultant, you could be, I know pharmaceutical companies have more than just being a pharma rep, and it's not just being a
Oh,
pharma rep. Yes. You could be a clinical nurse specialist, you could be a clinical nurse consultant. I have my master's in leadership. So, I mean, that's something that if I wanted to be a medical science liaison, I know that at some point that's something that I considered. Um,
wow.
all of these like jobs are amazing. And, you think, these are companies that I'd say, all of your top five, top 10, all of them are global companies, right? Like there's
Mm.
like none of them are just like in New Jersey or just in New
Yeah.
York City, right? So
Hmm.
I think when you think about for young people who are looking for portability, who are looking for that upward trajectory, or like the what should I be doing in 3 to 5 years? This is like 100% couple things. That common denominator with like trying to keep it oncology, cardiovascular, like I said at the beginning. Also networking and just making sure that you're setting yourself up for those conversations along the way because you don't want to start preparing when you're ready or,
Mm.
like you said, when you're burned out, right?